What's going on, everybody? My name is Eli, and welcome back to my YouTube channel. Today I'm bringing you the 11th episode of the Clinic Diaries series. I know I missed last week, but I'm back. And boy, do I have stuff to talk about. So for those who missed it, last week I was on oral surgery rotation. The way that oral surgery rotation works at my school, in your third year, you do a 1-week rotation where you spend half the week at the oral surgery clinic in the school and half the week in the oral surgery department at the hospital, Boston Medical Center. In your fourth year, and in the second year of the Advanced Standing Program, which is a program for foreign trained dentists, you do a 2-week rotation in the oral surgery department. 1 week at the school, 1 week at the hospital. For those who are new to the channel, my name is Eli and I'm a third year dental student at Boston University Goldman School of Dental Medicine. On this channel, I make dental school vlogs as well as videos with advice for pre-dents. So if that's something that interests you, please make sure you subscribe, share the channel with anyone else that might find interesting. Like the video, comment under the video, etc. So, it's been a long week. It is Saturday night, and I'm just now recording this video. And yes, I am going to be recording and editing it, and making sure it is posted and up by 11 a.m. on Sunday. Let's talk about my week in oral surgery rotation. The week was so long, it's really like a recency effect going. My best memories come from Friday. But I did take some pictures throughout the week, and let's see. So Monday was kind of like getting oriented to things. I started my week at the school clinic, and we switched after lunch on Wednesday. Monday, I just took a lot of consultations, assisted with extractions, but I didn't do too much, honestly. Tuesday, pulled my first tooth. Here's a picture. I'll be honest. The crown fractured basically as soon as I put some forceps to the tooth. I ended up getting some help from my professor. He helped me elevate the tooth a little more. And then I was able to get the root tip out with the forceps. Wednesday, I extracted my first molar. I was pretty happy about that because I didn't need help. Did it on my own. It was a maxillary molar, so those are not too easy. I will say, it was kind of a layup because one of the roots were already exposed, so it wasn't hard for me to reflect the tissue back and just use some forceps to try to wiggle it out, not have to elevate and all that stuff. What else? I gotta look at my pictures to really remember. Like, it was a long week. I will say it was a very, very long week. And it was tiring. Like, I just feel like, that was the first time I really experienced it, where it's like, to be a dentist 9 to 5 every day. And the school environment and the hospital environment is definitely a little different than what you would experience as a dentist, as well as working 5 days a week. You can, but you don't need to do all that. But yeah, there's pictures of everything. Wednesday, when I switched to the hospital, which Wednesday I also pulled that maxillary molar, I basically extracted a wisdom tooth, upper wisdom tooth, number 16, for those that know their teeth numbers. I elevated, and then a resident took it out with the forceps, but literally it was already out. I probably could have grabbed it with my fingers. Does that count? I don't know if that counts, but whatever. Thursday and Friday, I saw a lot of surgical extractions at the hospital. And that's probably why I didn't get to do much at the hospital. But I feel like I got a lot of experience just watching those surgical extractions, seeing how to raise flaps, how to suture, how to pull impacted wisdom teeth, how to, all kinds of stuff. But Friday evening or Friday afternoon, I saw a very cool, kind of rare case that I'll share with y'all. On Friday, in the beginning, I saw an inmate. So the prison brings inmates over to the hospital to get extractions. I took the initiative to go into the room first because I figured it would comfort him to see someone that looked like him and put him at ease about his extractions. A lot of people that come into the hospital are nervous, and they associate extractions with pain, and most of everyone that we saw wasn't getting put to sleep. So I can only imagine how nerve-wracking that is. It was very satisfying when they came in and I was able to kind of put them at ease by answering all their questions and all the reasons why they should feel comfortable with the doctor who was about to extract their wisdom teeth. It was important that, you don't judge a book by their cover. They deserve equal care just like everyone else, and I wanted to kind of make sure that they got that, same treatment that everyone else that comes into the clinic gets, because I think that's important. And, one of the reasons why I wanted to be a dentist is because I felt like I could relate to people that other dentists couldn't. I felt like me being a dentist would help put someone that looks like me at ease when it comes to getting dental work. And I saw the firsthand effect of that on Friday with that patient. Friday afternoon, I saw something I've never seen nothing like it. This panoramic x-ray will show you that this patient had roots that were longer than you may ever see. I will find on Google a regular pano image so we can compare the roots of these teeth, right? Now, if you remember the picture of the canine that I pulled on Tuesday, you remember what that root looked like. This is a root of a tooth I saw get extracted on Friday. Double the length. It was crazy. It was crazy to see on the pan, and honestly, I had to stay late on Friday just to see the extraction, and I did it because I wanted to see something cool and I wanted to get that experience so I could share that experience with you all. I think it's important to remember as a student in your 3rd and 4th year in dental school, these are one of the only times that you'll get to essentially try almost anything you want and have someone to fall back on. You're operating under someone else's dental license. You are operating with a chaperone. Why not try all the new stuff? Why not give it a shot, If you mess up, it's okay. It happens. The beauty of it is that 9 times out of 10, messing up in the field of dentistry is not going to kill somebody. Thank God. Y'all know what I mean, man. But anyway, oral surgery rotation was definitely one for the books. I mean, I had so much fun. I learned a whole bunch. I got to practice not only extractions, but giving injections for anesthesia. I think it was very fulfilling. While it was very tiring, I think it was very, very rewarding. And I truly just enjoyed the week. I am sad that I have to go back to going to class every day now. But I am ready to get back to the clinic, back to seeing my patients, back to practicing things that I will need when I graduate, and back to work. Grind doesn't stop. So here's to an 11th episode of Clinic Diaries. I'm sorry that I had to take a week off, but life was just way too hectic. But I'm back, and I'll see y'all in the next video. I have a couple cool videos coming out soon that I can't wait to share with y'all. But in the meantime, go watch some dental school vlogs while you're here. I'll see y'all in the next video. Peace.